When the mission is noble and efforts are sincere, the invisible hand of God helps you surpass all hurdles. And when the goal is to empower and nourish humanity, humble beginnings turn into an incredible journey of success. Shroffs Foundation Trust, SFT, is one such success story. The not-for-profit NGO started way back in 1980 to uplift the lives of underprivileged community living in the vicinity of the Shroff Family Enterprise Transpec Industry Limited. Under the dynamic leadership of Mrs. Shruti A. Shroff, SFT has progressed remarkably and continues to spread its wings far and wide. It now follows a structured multidisciplinary program that works in the areas of community development, land and water resource development, livelihood programs, medical and public health programs, education and training programs, and social research documentation. SFT also runs institutions in healthcare, vocational training, agriculture diversification, and Tribal Women Producers Cooperative. The focus of SFT is inclusive growth of humanity. We are guided by the operative philosophy of Sahaviryam Karva Vahey, a Sanskrit phrase which translates to "Together we will achieve in the best, together we will grow, and together we will prosper." Through empathy and support, we lift our society and community as a whole. SFT has its headquarters at Kalali and centers at Chhota Udepur, Padra, Dediapada and Hodko, Banni in Gujarat. Right from the beginning of SFT, Mrs. Shruti Shroff declared healthcare a priority. In 1988, based on a need expressed by village elders of Kalali, we started as an OPD with vaccination center in 2 rented rooms. In 1.5 years, the village panchayat gave the land to build a hospital. In 1988 to 89, the construction of building commenced. In 1990, the Ramakrishna Paramhans Hospital was inaugurated at Kalali with general medicine and pediatrics departments. Today, it is a multi-speciality 70-bed hospital. It is a full-fledged hospital providing medical, obstetrics, gynec, orthopedics, dialysis and general surgical services with ICU, NICU, PICU and diagnostic facilities like digital X-ray, sonography and pathology laboratory. It also has a pharmacy. Patients from Kalali avail these services. RKPH has now expanded to add a state-of-the-art at Uro-Nephro Speciality Unit and Surgical Block. The hospital will raise awareness on prevention of renal ailments as well as ensure its timely diagnosis. It will also offer high-quality renal treatment at subsidized rates to rural and needy patients. other key institution of SFT in healthcare is the Sharda Medical Center in Chhota Udepur. In 1996, we started a clinic with day care center in 2 rooms at Rangpur village. In 2009, we started Sharda Medical Center SMC at Chhota Udepur, a 16-bed hospital. The biggest challenge in this area is severe malnutrition, high prevalence of sickle cell anemia and low hemoglobin. Blood storage facilities have been started to help the anemic patients. Services of SMC at Chhota Udepur go to poor and most needy patients. SFT also operates a mobile medical unit focusing on public health programs for the benefit of people living in remote tribal villages. We started healthcare services in Banni, Kutch in 2001 with the mobile medical unit after the devastating earthquake hit the area. And in 2006, we started Sharda Medical Center SMC, a 16-bed day care center at Hodko, Kutch. SMC Hodko functions for 12 hours, providing primary health services, which is almost absent in the area. Round-the-clock ambulance services support critical emergency patients so as to take them to tertiary care centers about 80 kilometers away. In 2012, we also extended services of a state-of-the-art mobile medical unit to cover around 40 villages in the Banni area in Kutch in public-private partnership. Alone we can do so little. Together we can do so much. These famous words by Helen Keller are a guiding philosophy at SFT. Through this approach, SFT wants to ensure that the capabilities of the society are built to a level where the key driver of development and growth is the society itself.